Hello and welcome to Sugarloaf Mountain, and today we're going to be talking about mycotoxins.
Well, hello everybody, this is Dr. Corey King from AskDrKing.com. We're back here on a local summit here in Boulder, Colorado to be teaching you about mycotoxins today. Now, if you've been following along with my story, Natasha's story, you'll know that we are living in a home in Southern California in a city called Laguna Beach. Beautiful area, absolutely loved it. And we found that we had black mold in our home. The black mold triggered Epstein-Barr virus to turn on in Natasha, which then triggered Hashimoto's disease, which is an autoimmune condition that attacks the thyroid, and that turned on in her body due to the Epstein-Barr virus. If you're watching this and you've been diagnosed with Hashimoto's disease, I highly encourage you to have your doctor run the Epstein-Barr virus markers, because many times EBV is the precipitating factor for triggering Hashimoto's to turn on. I see it in a ton of patients, and EBV can mimic a lot of thyroid symptoms such as just fatigue and brain fog and the inability to recover. So you want to get to the true root cause of why you have your condition. So if you have Hashimoto's disease, make sure have your doctor run the 4 Epstein-Barr virus markers. If you'd like to download those, feel free to jump over to my private Facebook group. It's just Dr. King's Thyroid Support Group on Facebook. You can download those from the file section. Now, we found out we had the black mold. We moved out of the house in 2 days, but the damage had been done. So Natasha started getting extremely sick. So we ended up moving to Austin, Texas, and part of that move was to consult with a mold specialist there and to help Natasha recover. So what we did was, first we tested for the mycotoxin levels. Now, mycotoxins come from spores of mold, so water damaged buildings, and they can also come from food. Now, most people don't realize that mold, other than just seeing some old food in the refrigerator that has mold growing on it, they don't realize that mold can also be undetectable to the human eye. So I grew up in South Carolina out in the farming industry, and you see a bunch of silos. What the farmers do is they will store their grains in those silos up to 2 years. Now what happens is those grains can start to grow mold on them. So maybe you're reacting to grains and you're not necessarily a gluten sensitive patient, you've tested for that, but you could be reacting due to the mold that's on the foods. Now, in the last few weeks, I've tested a ton of patients' mycotoxin levels. Guess what? Not only do a majority of those patients come back with high levels of mycotoxins from water-damaged buildings, we're also seeing high levels from food sources. Now, the reason I run these tests is if a patient knows that they lived in a home that had a leaky roof, or they had some water damage, and they know that they were living in a home, or they suspect that they may have had some mold growing in the home, that is when we run these tests. Just yesterday, a patient, she's from Tennessee, extremely excited to find out that you can actually test for mold in the body. And when I told her she could, she's like, oh my gosh, I'm a realtor, and for years I was selling foreclosures, and she was walking in and out of these homes, and she started noticing that she was reacting when she was walking into some of these homes. Now she can't walk through the perfume aisle or the perfume section at the mall or the chemical section in the grocery store without reacting. And that's what started happening to Natasha and myself. So you can test for these mold levels, these mycotoxins, whether they're coming from water damaged buildings or they're coming from a food source. The 2 companies that we used Real-Time Laboratories, and they are based out of Texas. That is who we tested Natasha's mycotoxin levels through. Myself, I wanted to compare another company to see if we lived in the same house, are we going to have the same types of mold in our body? So I used Great Plains Laboratory, and when I got my result back, my mold count that was very high in Natasha was also very high in myself. So I feel really confident in both of those labs. So it doesn't matter to me which one you're running as long as we're testing for the levels of the mold in your body. Why do we want to test? Well, because the treatment for getting rid of mold in the body is very time intensive, it's expensive, and you want to know why you're doing those therapies. So, you test for the mold, you see you have high levels. Now what? We need to get the mold toxins, the mycotoxins, out of your body. This is how we did it for Natasha, and this is how we're doing it for myself, and this is what we are doing in my clinic here in Colorado. One of the best therapies that we did for Natasha, and this is what I'm doing for myself as well, is ozone therapy. So essentially, you're draining a certain amount of blood out of your body, you're injecting what is called ozone into this bag. So you drain the blood out, you got this bag of your blood, you inject the ozone into the blood. It's really cool because you'll see the colors of the blood change when it becomes oxygenated. But you're inducing this extra molecule of oxygen into your blood to help bind the toxins. Now, we did a ton of that for Natasha. She was doing 3 ozone therapy sessions a week for almost 4 months. And we continue to do those, just not as intensive or as frequent. That was the one therapy that every time she got ozone done, she goes, oh my gosh, that makes me feel so much better. So you can do ozone IVs, you can do ozone minor, which is essentially just taking some ozone in a syringe and injecting it into some of your soft tissue in your body. Another way that we started getting the mold out of Natasha's system and my system, bentonite clay, activated charcoal, those are great for binding mold or mycotoxins that can be in your gut. Make sure to take those away from any other food or supplements because they will bind the good stuff. So bentonite clay, activated charcoal, both of those are really good at binding toxins, especially in the gut. Sauna therapy. We can get nitpicky on saunas, but here's the big picture. We get rid of toxins through sweat, urine, and feces. So as long as you're sweating, to me it doesn't really matter if your sauna is a near infrared or if it is a far infrared. We purchased a near infrared sauna for our home. That's just what we got. Now, sitting in a sauna is a little different for each patient. So for myself, 12 minutes in a sauna and I am dripping sweat like I'm back in South Carolina in the summertime. For Natasha, she literally had to sit in the sauna for almost 45 minutes before her body started sweating. Why would it take her so long to sweat? Her genetic tests have answered this for us. She is a slow detoxifier. We see that in her genetic mutations. And this is one reason I feel she was affected more due to the mold than I was. By looking at Natasha's genetics, we figured out that she's a slow detoxifier because of some of her mutations. So essentially what that means is, imagine you have a 1-gallon bucket that through your life, toxins are filling up your 1-gallon bucket. Maybe you're the wife. Now let's look at your husband's bucket. And we're really talking about genetics here, but let's look at your husband's bucket. Maybe his bucket is 5 gallons. So you guys are living in the same home, eating the same foods, participating in the same sports, but the wife gets really sick and the husband doesn't. Why? Well, genetically speaking, if the wife can't detoxify very well, her bucket is going to fill up sooner than the husband's bucket. That's exactly what happened to Natasha and I. Her bucket filled up so much sooner than mine did. She got really sick, she got the virus, she developed an autoimmune condition where I didn't develop any of that. Am I lucky or is it genetics? It's genetics. We can look at this stuff now. So I've talked a lot about genetics on some other videos, so just go and watch those. We won't dive into that right now. So we tested all of that. We saw that Natasha, she's a slow detoxifier, so when she got into the sauna, it took almost 45 minutes for her body to begin sweating. Well, as we started working on her genetic mutations and started getting her healthier, she now sweats sooner than 45 minutes. So sauna therapy is great. You want to make sure you're dripping sweat. Okay, however long it takes you to sit in there, just make sure you're dripping sweat. Another great way to bind toxins is glutathione and N-acetylcysteine. N-acetylcysteine is the precursor to glutathione. Your body makes this naturally, predominantly in your liver. Let's go back to genetics really quickly. Natasha has several genetic mutations that impact how well her liver detoxifies. So what that means is her body's going to have a hard time making glutathione. And sure enough, we saw that in her genetic testing. So what does she need to do? She must take glutathione. Now, how can you get glutathione in your body? You can do it through IVs. You can do it through drips. You can do it through pushes. Natasha could not handle that. She got extremely sick. She got extremely nauseous with that. So then we started doing oral glutathione. The oral glutathione, it must be a liposomal and a reduced form for you to take it orally and for your body not to essentially break it down in the stomach. The product that I use and recommend also has N-acetylcysteine in it. So we get N-acetylcysteine, we get a liposomal and a reduced form of glutathione. We get that all in one product. Natasha could only handle 0.5 milliliter in the beginning. If she took more, she felt sick like she did with the IVs. Myself, I tested this out. I don't recommend doing this. I went all the way to 17 milliliters and I didn't have any type of a reaction, if you will. I didn't feel nauseous, I didn't feel sick, but I only take 10 milliliters per day. Natasha still only takes 1 to 2 milliliters per day. So those are ways that you can get the toxins out of your system. You can do ozone therapy, you can do sauna therapy, you can do bentonite clay, activated charcoal, glutathione. Those are all fantastic at helping to get rid of the mycotoxins. Now, after you've done that for a certain amount of time, this is what you and your doctor should talk about. I recommend going back and rechecking your levels. You want to make sure all this hard work and effort and money that you're spending is actually doing the job. So when you can see that your levels are going down, it gives you more hope that your body's healing and you're headed in the right direction and that you're going to be able to manage your chronic health condition properly and just get back to kicking butt in life again. So that's today's video. I hope you enjoyed it. If you have any questions, feel free to email me, drking at AskDrKing.com. All right, we'll see you in the next video.